Consumer's doctor on the behalf of foremost organization. As a consumer's doctor, my focus always has been on consumer-driven, personalized healthcare, so-called demand-controlled healthcare, customer-driven healthcare. It has always been my focus. It has to be customer-driven. Then only we will be able to contain the cost. The solution for the rising healthcare costs, give the control back to the consumer folks. That's where the beauty lies. So like any other sector where we have seen, like retail sector, you name it, and food chains, we have been successful so far. For some reason, we have been hesitant to give the control to the consumers as far as the healthcare is concerned. I have no idea why, but I continue to strive for a consumer or customer-driven healthcare. Today's topic is developing a national consensus. President Biden is going to be our president. I have full confidence on President Biden. He has been in politics for the last 40 years, so he knows exactly how the system works. But as Americans, irrespective of their background, Republican or Democrat, this country is based on the fundamental principles of consumer demand. We have been successful so far. So I really believe whatever the President Biden and the Democratic Party does, it is good for the country. I'm sure what is right for the country. Even if they're talking about Medicare for all, it has to be consumer-driven, folks. It has to be customer-driven. There's no other choice for us to lower the cost. It has to be customer-driven, consumer-driven, personalized healthcare. So how would we develop a national consensus? Developing a national consensus. Let's talk about it today. Let's focus on that. Okay? So that's going to be an interesting topic to talk about, which gains attention. Basically, we need attention, interest, and action for the sake of all Americans, folks, irrespective of their socioeconomic, any race, irrespective of their background. Real change requires a real change. It does. Of all the stakeholders, the consumers must be in the front and center. There's no doubt about it. It doesn't matter, even if it's Medicare for all. It doesn't matter what Democrats have come up with. But consumers have to be in control. Remember, for most, access to affordable healthcare starts with affordable health insurance, folks. This is where our focus needs to be, affordable health insurance for all Americans. Advocating a personalized health insurance will require consumers change from passive interest to demanding action, folks. We want the consumers demanding affordability, competition, not consolidation, and full transparency in payments, pricing, on the insurance side and on the healthcare side, both. Americans have to get politically active and personally aware of their ability to make a difference. Yes, I'm going to give you some ideas how to develop a national consensus, folks. Here are some ideas. Number one, write to your congressman. senators, and other elected officials. Ask an elected official to form and participate in a health insurance reform. Health insurance reform. We can still embrace Medicare for all. I'm not disputing that, but we need a fundamental change in health insurance reform. That was number one. Write to your congressmen and senators. And number two, write op-eds like what I'm doing, telling you folks. People who are listening, write op-eds for your local and national papers, folks. I'm doing my part. Going public. I only do as a person, as an individual. My limitations are very little, but you guys, you folks, when you're listening, you have to get involved. So write op-eds, the local and national papers. You can express your concerns and make some comments on this particular Consumers Doctors channel. And number three, be a guest or a caller for local, regional, and national radio talk show. Be a guest. Well, I have no problem being a guest if somebody invites me, but I'm doing my part. So be a guest for the local, regional, and national. And contact number four. And number four is respond to articles and posts on social media, folks. That is a powerful weapon. Respond to that. Those posts, the Facebook, Twitter, you name it, Instagram. Respond to them. What do you think of healthcare? It has been so dysfunctional so far. You, as a consumer, can change it. You have the power to change. It doesn't matter whether you're Democrat or Republican. It doesn't matter. It really doesn't matter. What you need is an affordable healthcare. And number five, contact your human resource department and request for a more consumer-driven and patient-centric options. Wherever you're working, for the large or small, mid-sized companies, go to the human resource department. Request for a consumer-driven, patient-centric options on having a health insurance. And number six, make additions to your health savings account. If you don't have an account, qualify. How do you qualify? This is where I've been telling you, folks. Get the insurance which is HDHP. It's a deductible plan which lowers your premiums. It saves money for your employer, employee, everybody, and contribute to a health savings, which is a tax deductible. So HDHP, HSA, what it stands for, health disclosure, healthy pricing. Instead of, I would not call it deductible. I would say health disclosure, healthy pricing with health solutions advantage. So it has a combine of paying premium and at the same time, whatever money is put aside into health solutions advantage, which is called HSA. So make contributions. And number seven, understand and meet the standards for your company's rewards and incentives. Company will give you the rewards and incentives when it comes to healthcare. Fully understand what it is as you as a consumer can do to save and make money on healthcare. And you could be financially independent if you make wise choices, folks. You need to understand the incentives and rewards from your employer as far as the healthcare is concerned. And number eight, lower personal and necessary utilization of medical services. How do you lower personal utilization of medical service? Well, listens to the consumer doctor. He talks about healthcare, and you can request for certain topics for me to talk about on healthcare, how you can, if you have diabetes, hypertension. I've been talking about yoga. I've been talking about meditation. If you have mental health, address and look. Folks, your information is right at your fingertip, folks, on your mobile phone. Google it. Get the information what you need. Educate yourself. It will save money for you. So you need to lower your utilization of medical service by gaining knowledge through your mobile phone technology, folks. Instead of going on the social, go on Google for the healthcare information, what you need. So you can lower your utilization, definitely. Because you're in the front line. You can fight for it. And number 9, know and control your biometrics, your BP, your cholesterol, your body mass index, your waist size, your hemoglobin A1. So you really need to know your health. You need to focus on your health. That's why I've started a segment, so-called HIP. HIP is Health is Platinum segment, folks. Health gives wealth segment. So listen to the consumer's doctor and follow on HIP. Health is Platinum segment, where consumer doctor gives you an advice on different healthcare topics. You can gain the same knowledge from your mobile phone by on the browser, put the topic what you're interested in. But first of all, before you know it, you need to know your body. You need to know your biometrics, your cholesterol, your body mass index. You need to know your mental health status. All these things, you need to take charge on your health, folks. Health is an asset. I've been telling all of this is an asset. You need to take care of your asset, folks. It doesn't matter where you're coming from, which your economic status, it doesn't matter. Personal responsibility is so critical. So you need to know your own biometrics. And number 10, last but not the least, don't smoke and do illegal drugs or abuse alcohol. This is easier said than done, folks, but I understand that. But as long as you're personally responsible, I believe you guys know what you're doing. Getting into drugs is not a good idea, folks. I know we have been talking about, there are ways to have fun, but the last thing you want to do is drugs and alcohol. You can have alcohol for socialization. I'm not discouraging from social ingestion of alcohol, but don't get carried away. That's and smoking, it is not, once in a while it's okay, but all these habits of smoking, it can cause problems to your lungs. You need to realize that. So smoking always has side effects. So get into some good habits. Get into things which makes you feel good mentally and physically. That's your focus should be. When politicians and media, folks, media has been so divisive in this. The media doesn't focus much on personal responsibility. I have no idea why, but media can play a big role. When politicians and media says there's no alternative to the government control, so-called Medicare for all or single payer, respond loudly that you know better. because it is your financial independence at stake, folks. It is you as Americans, as as a country, we have come this far. We cannot fail on our personal responsibility, folks. I don't like what happened on January 6th in Washington. I just don't like it. I think we need to encourage politicians to bring us together, not to be divisive. If people make divisive comments, discourage them. This is not the way we have to run the so-called the country. We as a country have come this far. We cannot be divisive. We need to come together, come to our grips, and do the right things what we need for the country, folks. That's the least thing I could do. Ultimately, it boils down to you, folks. You are basically, I'm counting on you guys. Ultimately, all affected stakeholders need to gain from legislation. Yes, whatever the legislation we have, it has to be good for all Americans. A strategy for developing a buy-in from health industry is to establish a healthcare consensus. We need to have a common healthcare consensus addressing the most pressing needs for each stakeholder, including the uninsured. We need to address that, including mostly address the uninsured. That's our primary target. Uninsured. People are economically. That's the focus, folks. Address each stakeholder, especially the uninsured. Legislation must meet their needs and allow them to function in a new, more effective, consumer-directed, patient-centered market, folks. That's what your focus should be, consumer-directed. Even I'm talking about insurance-wise, it has to be consumer-driven. Insurance needs to be reformed in consumers' favor. How about that? In your favor, especially uninsured favor. It has to address the uninsurable. That's our focus, is uninsurable and economically impaired group. That's our target, folks. We need to address that. It's not going to be easy. Nobody's saying it's going to be easy. Even with flaws, some stakeholders are benefiting from Obamacare. There's no doubt about it. Some folks are benefiting. And with the status quo, there are folks benefiting from either side. Others are fearful of political promises and change. You need to focus on each stakeholder, folks. My focus is on the uninsured and impaired and disabled and chronically ill. That's my focus as a consumer's doctor. We need to address those concerns. People who have chronic illnesses. That's what we need to look at. We need to do a Medicare. Yesterday I was talking about Medicare personal care accounts. That's a beauty, folks. If the Medicare is dwindling funds, Medicare is going to be bankrupt. They keep saying Medicare's funds are dwindling and it's going to be insolvent. Let's go for the Medicare personal care accounts. Let's head that direction. Let's set up a Medicare's personal care accounts. And also I'll give you the options how you can fund it. Medicare personal care, and you are in charge. Nobody can take it away from you. Remember, with no consensus for a free market solution, Obamacare upended the entire insurance market and forced over 200 million Americans into government-controlled programs with new taxes and burdensome laws and rules and regulations is going to be very burdensome. We, as a country, Americans, I know for sure they don't want to be told by anyone. It doesn't matter. They believe in themselves. They don't want to be told. Look at what we are doing in the retail sector. Look at where we are in the other sectors. Americans demand freedom in healthcare, total freedom in healthcare. It doesn't matter how you do it. It doesn't matter. You know, when you talk about healthcare, it has to be addressed to all the stakeholders, and it has to give freedom to all the stakeholders. That's what our focus needs to be. Consumers could not keep their doctors or their insurance policies. They were forced to buy coverages that government thought they needed or face financial penalties. You cannot force on anyone. That's the thing. Another, you cannot force on people to buy something which it doesn't address the primary issue, which needs to be consumer demand. It has to be demand control healthcare. It has to be consumer demand, customer demand healthcare. To a large degree, folks, you believe it or not, politicians exploited the failures of the old insurance system. They exploited the failure of the old insurance system to pass and implement Obamacare. But even the opposing forces failed to offer and coalesce around a viable alternative. I have no problem with Obamacare. Did something good for all of us. Yes. You know, it has addressed the issue of pre-existing illness. It has, and it has addressed the guaranteed health coverage. I fully agree with that. We need to have a pre-existing coverage and guaranteed insurance for all Americans. It doesn't matter. Let's do it in the right way. But politicians always wants to control. I don't know why. I don't like it. When they base their policies on controlling people, I don't like it. People are independent. They're independent thinkers. They know how to take care of their. Don't look like Americans are stupid. We are not stupid. We are not stupid. We can take care of our health. I believe in Americans, folks. I believe in our country. As American, I believe we have good options in front of us. Let's make it as a national consensus to address the healthcare to be personalized, customer-driven, consumer-driven, demand-controlled healthcare, folks. I cannot re-emphasize that fact. We need to take control of the healthcare. Personalized health insurance is a solution, is ready to go today, folks. The thing is, so far, insurance companies have been resisting to segment the risks. I have no idea why. Why can't they segment the risk into 4 categories? Why can't the premiums be based on 4 categories? I've been talking over again regarding the segmentation of the risk. Well category. Number 1, majority of the Americans are in well category. I would say 80% of the Americans are in good health. Why can't we address that and lower their premiums when they don't see their doctor, but these folks need to be personally be responsible in taking care of their health. And well category, at risk or acute conditions, sometimes, we get into car accident, we get smokers having pneumonias, strokes. These are all accidental. So at-risk category, we can give a premium for people who are smokers, who are drug addicts, who are hypertension, diabetes. We can base a premium differently for these folks, at-risk folks. That should also go down by technology, folks, online telehealth, telemedicine. We can encourage these people to be responsible. Telehealth is going to revolutionize the healthcare. I strongly believe in that. I strongly believe in that. And chronic illness, there's only 15 to 18% of the population have chronic illness. Don't you think we can handle the people on chronic illness category by having a premium based on the chronic illness and adjust the premium and encourage them to be proactive? So these are the people we need to focus our attention. These are the people, by dumping them to Medicaid, it's not going to solve the problem, folks. We need to focus on people with chronic illness. This 18% of the population with chronic illness, we can handle it. And even that 27 uninsured, we can handle it. But let's address the primary issue of segmenting these risk. Premiums have to be based on segmentation, folks. And the last but not the least, which Obamacare brought the attention to, is catastrophic coverage, these are the good things Obamacare has taught us. Let's address those things and focus on the customer, Americans, consumer driven, folks. But don't force on people to buy something which they don't need. Give them the proper tools. Invest in Americans. Invest in America. Wasting $3.7 trillion year after year. We'll never see it again. And it has surpassed the national defense budget. And in spite of all, we ranked 37th in the world, folks. It's not acceptable. We ranked 37th. These slogans of government control, private control, it's a non-issue, folks. It doesn't matter. There is no control on anything. Customers, consumers, Americans, they can handle the healthcare by themselves. Give them the tools. Invest in America. I wish people who deserve the most, give them, if the health savings accounts, so-called health savings, invest and put the funds. Government, right now, like they give $2,000 for every American because of the pandemic. Invest in $6,000 on each American and contribute into the health saving. Let Americans handle that $6,000 in their health savings. That can be spent only for invest in Americans. That is the best thing you could do. It goes a long way. As I said earlier, including seniors, have them set up Medicare personal care accounts, folks. You really need to have a personal care accounts for all 320 million Americans. Invest, even illegals, invest in them. Try to address the problem instead of dividing us and making things worse. It just doesn't help the country. I just hated when I saw what happened on January 6th in Washington. It is just not right. We are not that. Most of the Americans are patriotic. We were incited into the patriotism is a national phenomenon. I have no problems with patriotism, but express your patriotism for the right things. We want independence. We all believe in independence. We don't want to be told by anyone. It doesn't matter. Anyone. Nobody can tell us what to do. I really believe in that. I really believe in that. I think the technology is paving the way into these so-called artificial intelligence and blockchains. You're talking about payments. That's going to be, we even talked about the payment. That's going to be reformed through, you'll never know, the cryptocurrency. We have been talking about cryptocurrency, bitcoins. This America is, you cannot have 28 trillion, you cannot keep printing the money like what we are doing now. $28 trillion, just not acceptable. We need to be better than what we are. We can do it, folks. Folks, if you do like this channel, subscribe to Consumers Doctor on behalf of Foremost Organization. Subscribe, share, and hit that notification bell. And as a Consumers Doctor, I'll continue to hammer on personalized healthcare, folks. I really believe it. I really believe in customer-driven, demand-control healthcare. That's why, I even have all the domains: Google MD Live, Microsoft MD Live, Amazon MD Live. You name it, folks. I want to basically take the healthcare to a new level, folks. Let's do it all together. We'll see you next time. I love you guys. Thank you. Salute.